JB, and thank you all for joining us today. As JB mentioned, I wanted to hit on just a couple of key issues that are on everybody's minds, and we've been getting a lot of questions about and have made some progress and have some new information for you all. So first, one of the questions we get most frequently is how many people do we expect to actually have on campus in the fall? So part of that is dictated by enrollments, what kinds of classes students are signing up for. Parts are also dictated by our staffing. So we have more staff and faculty working from home, for example. And now we've got sort of the emerging data on how our students are picking classes. And we wanted to share that as of today, it looks like if you count seats in classes, it looks like about 3/4 of our seats will be delivered in a fully online way. About another 20% or so of those seats will be in hybrid classes, leaving only about 5% of our seats in fully in-person classes. Put another way, about 45 to 50% of our students as of today have elected for a fully online schedule. So that we think is encouraging. We're happy with that mix of courses for our students. Those numbers are largely reflecting student choice. Students are opting whether to sign up for more of the hybrid or in-person classes or more of the online classes. And when that reduction in density in our campus is combined with our various safety measures and our testing measures, we think and believe this is going to create a safer campus for everybody. I also want to say thanks to all of our faculty and staff for a lot of hard work to come up with this course schedule and for adjusting the way we do what we do to make it a safer environment and to offer our students more choice. On the testing side, we're rolling out a very robust and strategic testing plan. And one of the things I'm especially proud of is, as a top world-class research university, we're relying on our in-house expertise. And that has come through the form of the Dell Medical School, our UT Health functions, as well as our scientists. And so we're able to use the work of many of the amazing people here to deliver this testing capacity. Also, by developing this ability in-house, we're much more insulated from many of the supply chain issues that can affect testing through relying upon an outside vendor. We also think we'll be able to offer a very high level of service. We all know that testing is a vital part of what we do. Dr. Hines is here, and he can go into detail later about that. It's also important, though, to note that testing is just one piece of all of our efforts, and all of our safety is going to depend on many other aspects, including reducing density, as I mentioned, on our campus, our ability to socially distant, and also to wear masks. And as I said, we're encouraging more and more remote work and remote learning. So that's a high level, a couple of things I wanted to share with you around how campus is shaping up for the fall and how we plan to approach testing. And JB, I'll hand it back to you.
Excuse me, I was muted. The president sent a letter to the community today outlining our new testing strategy, or it's been in the works for a while, but outlining the testing strategy that we're rolling out. And if you'd like a copy of the letter, you can contact us. We'll forward that to you after the call. Just reach out to Ellie. But Dr. Hines can give us an overview of the testing processes and strategy.
Great, thank you, JB, and thank you, President Hartzell, for those opening remarks. Regarding our testing strategy, I want to highlight first that our plan is both strategic and nimble. We can quickly deploy testing to emerging hotspots or areas of concern across our campus, and it represents really a multi-million-dollar investment on the behalf of the university for our community. Our goal is to make testing as accessible and affordable as possible for students, faculty, and staff. Our strategy consists of 3 components. First, testing of individuals who are ill. Second, contact tracing along with expanded network testing and proactive community testing. The university anticipates that several hundreds of tests could be needed on a daily basis for individuals who might have signs or symptoms consistent with COVID-19. And we've stood up our capacity at University Health Services to test hundreds of symptomatic students each day in our in-house lab. We've also purchased 3 new machines, which allow for rapid testing, up to about 100 tests per day with a 15-minute turnaround time. That fast turnaround enables faster contact tracing, as well as decreases any unnecessary self-isolation. And we're contracting with commercial labs to serve as backups. With regards to proactive community testing, we believe this is a critical aspect of our public health strategy. It can help us to monitor the spread of infection within our campus community, within specific campus populations, and identified areas of higher risk, and it can give real-time feedback from our contact tracing team. Proactive community testing is, of course, designated for individuals who are asymptomatic or otherwise well. And our goal is to test about 5,000 UT community members each week using this strategic, scientific-based strategy. As I mentioned, we have 3 target groups. Those who are at higher risk of disease based on their inability to always practice social distancing through the functions of their job activities. Next, extended network testing, which casts a wider net than simply testing close contacts of symptomatic individuals, as well as broad-based random testing, which is designed to identify cases before hotspots may emerge. Until the pandemic ends, robust testing along with masking, daily symptom screening, social distancing, and hand hygiene are our best tools to help us mitigate the spread of the virus. And I want to reassure members of our community that this is a comprehensive and aggressive strategy to detect infection on campus.
Thank you. With that overview, I'd like to open it up for questions. So please, feel free to put your questions out in the chat group or in the chat window there. And while we're waiting for questions to come in, I do know, Andreas, do you know about how much the testing costs?
Yeah, the net costs for a proactive community test is about $25. That includes the reagents and the collection kit.
Okay. And the cost to students is free?
The cost to students is free, and staff, of course, yes.
Okay, great, thank you. All right, I don't see any questions. I wonder if I'm missing them in the chat window. Oh, hold on. Good, Brian Davis is coming in. I didn't think you'd fail us, Brian. And also, in terms of the investment UT is making in the testing, my understanding is that it's a multi-million-dollar investment from the university to stand up the testing. All right, Aaron Cargill from KXAN. What is the cost of all the tools and equipment you just mentioned to provide rapid testing, et cetera? And so I think for that question, we'd have answers from both Dr. Hines and from Andreas. Terrence, you want to start?
Sure. So the rapid testing equipment that we're using is called Abbott ID Now. We have acquired, or in the process of acquiring, 3 units, each with a 15-minute per test turnaround time. The cost is largely built into the cost of the reagents and the test kits. Each kit is approximately $75 to $80, and then you simply multiply that out by 100 tests per day times the number of testing days for the semester.
Thanks. And Andreas, is there anything to add in particular other than the overall investment?
Yeah, I mean, for the proactive community testing, UT was able to use some of the existing equipment and bought roughly $1 million worth of liquid handling robots and PCR machines and equipment around that to ramp up this high volume testing.
And we have some pictures of the technology being used in the proactive community testing. That's the testing that will ramp up to 5,000 tests a week. Ellie will put a link to that in the chat window. You're free to use those photographs if you're writing about it. All right, moving on. if there are other testing questions, just bring them up during the course of the call, but I'm just going to go right through the questions from Brian Davis. For Jay, how do you feel about having football at all this fall? And how do you feel about 25% or 30% stadium capacity? Also, what is your red line for the number of infections that makes you say we need to stop athletics?
Yeah, thanks.
He meant 25 or 50. He said, how do you feel about 25 or 50% capacity?
25 or 50, thanks. First, I think football at all, I remain optimistic that there will be football in the fall. And, I was part of the Big 12 Board of Directors meeting last night where we came up with a plan to have 9 conference games plus 1 non-conference game, and are sort of planning and waiting on the final word on when the season will start, but trying to push it back such that we can a little bit so that we learn more about how the disease is unfolding, and also get to see how others are handling sports. And so what's the experience in pro sports, for example, and how can that inform our decision making? As you've seen from the way we've been communicating, our thinking continues to evolve around football. We know that this is a source of concern for people in the community. How is this going to work, and is it going to be safe, not only for our student athletes, but also are we going to have an impact on, for example, the city of Austin if this doesn't go well? So we're taking it very seriously, and I know that Chris Del Conte and the entire athletics team is putting a lot of concern and care into it. And you've seen our thinking evolve a little bit as the disease has changed. We've talked about 50%, as Brian referenced in the question, and we've been moving more towards 25% now as something we're spending more time exploring. And it's everything from how do we seat fans in the stadium, how do they get in and out of the stadium, how does it affect the way we handle tailgating and concessions. So there's just a huge number of concerns and issues that we all have to sort through. The season's first game's still a ways away, so things can still change and evolve, and we may learn, and we may have to adjust further as things unfold. But as of today, I'm optimistic that we'll have a season for our student athletes and also for our fans, and that we'll be able to do so safely.
All right. Next question from Raga Justin with the Texas Tribune. Has fall 2020 enrollment generally declined or increased? Are there any available estimates? So I think, Jay, that's a good one for you.
Yeah, sure. Thanks for the question. And we don't release the actual numbers until the 12th class day, and we'll do that again this fall semester. But based on what we know today, and knowing that there's a little bit of time left between now and the start of the semester, we're actually very optimistic about ultimate fall enrollment. And the numbers look good, they're robust, and even from some pockets where we may have expected some weakness, for example, among our international students. So we're all hoping that travel conditions will permit everybody who has indicated that they're intending to come to actually get to our campus. But if you look today, it looks quite strong and quite good on a relative basis versus previous years.
Great. From Beth Sullivan at the Austin Chronicle. Are there any plans for UT to provide temporary housing on campus for self-isolating or self-quarantining students? I think, Dr. Hines, that you can take this question, housing for self-quarantining students, and if not, we'll have to follow up after the call, Beth.
Sure. And so self-quarantining is for individuals who are not having symptoms but have been exposed. Self-isolating are for those who have symptoms or who tested positive. The expectation is that students who are self-isolating would do so off campus, either at an off-campus residence, their permanent home, or through the city's isolation facility. Students who are quarantining, I don't believe are required to move off campus, unless of course they were to subsequently test positive. But the key in both scenarios is whether or not they're able to do the self-quarantine or the self-isolation safely and appropriately. And if they're not able to do so, the city's isolation facility is a resource that we would direct them to.
All right, thank you. Another football question from Raga at the Tribune. Do Austin health authorities have any say in determining football capacity this season? So
I guess that's right, JB? Yeah. So thank you for that. You know, we always want to be a good partner and a value member of the Austin community. So if you think about, do they have any say, we'll always want to have that dialogue with Austin health officials and to be engaged with them as we make our plans. As a state entity, the ultimate authority does reside with the state of Texas. And of course, our Board of Regents, our chair, also have a lot to ultimately say about our policy. So it comes down to the Board of Regents and the state, but we do value the city's input.
Thank you. Another question from Aaron at KXAN. How do numbers look compared to past years for students choosing to live on campus in the fall? And Aaron, I can follow up with you after the call with specific numbers. And I can take this question very quickly, which is we've seen a reduced number of students choose on-campus residences. And that probably reflects the large number of students that were described at the beginning of the call as pursuing online-only education. So that's reflected in the residence hall numbers, as you would expect. And we have some specific numbers as of today from housing, and I'd be happy to share those. I just have to get them after the call, so we can follow up by email on that. From Brian Davis. Brian, you're just not going to let us avoid football, I can tell. Okay, follow up from your conversations with Big 12 presidents and athletic directors. Do you have any ethical concerns about sending 18 to 22-year-olds out there competing in football? Who makes the call on whether a team has had too many positives, the school or the league?
Yeah, thank you. I would certainly have ethical concerns if I didn't think we could do so safely. And when we've had calls with the Big 12 or conversations on campus, all of our conversations have led with the safety of our student athletes and worrying about that first and foremost. So it is front and center on our minds. And we've been working with health officials to get guidance on how we think we can do this as safely as possible. And we are now working with the Big 12 on guidance across all of the A5 conferences to at least a minimum standard. And we expect to exceed that standard in many ways. For example, we expect to test our athletes even more frequently than the minimum that standard dictates. We have not specified ahead of time any hard rule as far as a call. If there's a certain number of positive cases, for example, on a team or in a community, then there's some trigger that automatically happens. But we know we're going to have to adjust and look at the data. And if we find out that people are getting infected as they participate in sports, much the way that we would do it on the academic side, we're going to have to look at our policies and our procedures and see where we need to make adjustments and do the best we can to figure out why it's not working.
Thanks. Another question from Aaron at KXAN. In May, a letter was sent to the UT community that said furloughs and layoffs could happen depending on the financial outlook due to the pandemic. Is that still on the table? Or have any layoffs, downsizing happened in any department? And Jay, you may have an answer on this, but I want to share a little information because we've had to answer this question a few times, Aaron. And one thing about furloughs is they're temporary. So I think some of furloughs have been in the news, like the Texas Performing Arts Center had some furloughs because they're not conducting performances right now. And it's one of our units that depends on revenue. And so during the pandemic, they have not been able to conduct their normal business. And a couple other units have announced furloughs. The McDonald Observatory did, but we have to check in answering the question. I have to always check pretty much week by week because furloughs are temporary, and so some people furlough and then the unit makes adjustments and they come back on. So we have had furloughs, but answering the specifics is something we have to check on each week. Anything, Jay, to add on that?
No, I would just, I guess the only thing I would add is there are things that have been immediate, like the fact that performing arts couldn't take place, and that had an immediate impact. We won't know the situation. We've talked a lot about football today. We obviously won't know that for a while, how that's all going to unfold until we try to play those games. There are other parts that will be that will unfold more slowly. So what's the ultimate impact of the state's budget on our operations, for example? And we won't know that until the legislative session and then the following year. So there are things that are more fast moving that we've had to adjust to quickly, and other things that will naturally follow as we learn more.
And I'm going to wrap up fairly with the next question or two. So get them in there if you have them. From Beth Sullivan at the Chronicle, again, the Austin Chronicle. Out of the 6 levels of campus operations status, at which level is UT planning to open for the fall? And Art or Dan, I think either of you could take this one.
So in our planning framework, we're opening at what would be level 3, which reflects the larger number of seats that are online than we had hoped for back in May, but still has a robust presence of classes on campus.
Next question from Tristan. From Tristan Balaktas, if a student or staff member who is attending in-person classes tests positive, what steps will be taken by the school to try to mitigate the spread? And will this trigger a shutdown of the campus? So,
Aaron, you want to talk about contact tracing, Dr. Hines?
Certainly. So one of the first things that would happen would be contact tracing, where a team that's comprised of Dell Medical School, UT Health Austin, University Health Services, and Health Point Occupational Health would, in collaboration, reach out to that individual, determine who had been in close contact with them, reach out to those contacts, and then begin to test those individuals. For those in certain high-risk areas, like living in residence halls, perhaps we might do that expanded network testing and not limit it simply to the close contacts, but maybe even everyone on a residence hall floor. And then we would work with our environmental health and safety folks to make sure that any areas that needed cleaning or disinfection, that would be done properly.
and then the second part of that question was, would a somebody testing positive trigger a shutdown of the campus? Art, is that one?
Sure. Yeah. I mean, we have a number of criteria that we use to try to determine both whether there are changes that need to be made to our procedures in general, as well as whether we need to shift the levels in our contingency planning framework. And certainly the presence of individuals who have gotten sick, we obviously want to minimize that. But you know, when we look at what would cause us to say shut down the campus, it would really require a couple of things. I mean, one is that we would have lost control of this process of testing and tracing and isolating individuals that Dr. Hines was talking about. And the other is that if we believed that activity on campus was having a significant negative impact on the broader community, but there isn't a specific number that would trigger a change in levels of our campus. We're really trying to make decisions on the basis of the overall situation.
All right, thank you. And so last question for now, and we're happy to follow up after the briefing with additional questions. Ariba at the Daily Texan, earlier in June, UT sent a proposal about the 5% revenue reduction to the legislature. Yeah, we sent our proposal of how UT would reduce costs by 5%. Is there any update on the 5% revenue reduction mandated by the state for the next year? So have we heard anything about reductions for the next year?
So our plan that we submitted was how to accommodate a 5% reduction for the fiscal year that we're currently in. So the one that ends in about, whatever it is, 27 days now, as well as 5% for the coming academic year, which would be the 20 to 21 academic year. So what we submitted was that plan. We are still waiting on guidance and the ultimate legislative outcomes to shape and understand what the budget outlook will be for the year starting 21 into 22.
All right. Thank you, everybody, for your questions. We appreciate you working with us in this format. If there are additional topics that we can address, it's sometimes hard, as you know, with all the interest in the pandemic and the demands on people's times, to set up the media interviews individually right now. But if there are topics you'd like to see us address in a briefing format as we come near the fall semester, please let me, Matt Penny, Ellie, Gary Sussline know. And we want to accommodate getting this information out to the community as well as we can. We'll follow up with additional questions, and thanks for joining us on the call.
Hey there, everybody. Will Dupree once again in the KXAN live room. We just concluded a press conference that UT Austin held to discuss a little bit more information about its fall semester, as well as detailed information about its new testing plan and strategy once the fall semester begins. So firstly, I want to share a statistic that President Jay Hartzell talked about. He said that at this time, at least 45 to 50% of students coming into this next school year have elected to fully online schedules. So they have set aside their time to be able to just do all their classes virtually. There will still be some held, but that's a fraction, obviously, of what would normally happen during a regular time. But at this moment, at least half of the students at UT Austin will be doing all online learning. Additionally, the information about testing is that there were several points to be made. So UT Austin and its medical system has purchased 3 machines that will have 15-minute turnaround on COVID-19 tests. And the chief medical officer for UT Austin said that they would be able to do 100 tests per day on those machines. However, what they're wanting to do every week on campus, they're hoping to have capacity to test 5,000 people for COVID-19. And that's in addition to contact tracing and other kinds of protocols that they're going to be putting in place. They were asked as well about plans for Longhorn athletics and what that would mean exactly, and that is still being developed, as the university president said just a few moments ago too there. We will be condensing a lot of this information and putting it out on our website, kxan.com, and on the KXAN News app. You can read the article there. We're working on updates right now so that you all have all the information you can, and you can share this video if you're watching live on Facebook as well. From the beginning, you can watch it over from there. We thank you again for watching our stream. I'm Will Dupree in the KXAN live room. We will see you back here another time with an update. Please stay safe and healthy, and if at all possible, still at home.